tutorial 8, we started having a closer look at the dental record screen, and more specifically, the buttons on the right. We demonstrated how to connect to an X-ray device and had a look at button statement all and button statement. In this tutorial, we will examine 3 more buttons: button discount, button prescription letter, and button scheduled appointments. Their function is self-explanatory. Button discount on the right performs the obvious task of providing a discount. At present, the patient does not owe anything, as you can see by the individual balance. We will perform another extraction on tooth 24 to raise the balance. Click on extraction. As you can see here, it says extraction, select the tooth. As we said, we will choose tooth 24. The work has been recorded. Extraction, tooth 24, debit 60, and the individual balance is now 60. We now click on button discount to define a discount. The discount can be defined by the user as an absolute number, say 6, or can be defined as a percentage of the amount owed, say 10%. If we click on discount calculation, the individual balance from 60 is now 54 and the discount is 6. If we press enter, the discount is recorded. In the notes we have discount 10%, and now the individual amount owed is 54. Button scheduled appointments shows the scheduled appointments for the specific patient. Click on the button. At present, there are no scheduled appointments, so we'll enter an appointment in about 1 month. To do this, we simply click on Renew Appointment, go to June, say June 20th, and let's have an appointment at 2 o'clock. And now we don't need to rewrite the name, we just click to the left and the name appears. If we now revisit scheduled appointments, you can see the appointment in the future. We can print the scheduled appointments and give it to the patient. Also, we can click on all appointments and see all the appointments that the patient had, together with any notes whether he kept the appointment or not. Button prescription and letter on the top right enables the user to prepare and store for future use several documents. These documents are prescriptions, letters, confirmations, certificates, or other general documents. We will examine how to create and store a prescription and a letter. After we generate these documents, we can print them or email them. Click on prescription, and immediately we're cautioned that the specific patient has a medical history. The dentist will take this into account when prescribing something. We click on New Text write a short description. And then enter the prescription. We can always come back and change the text. Once we're happy, we just click on Save Text. And this prescription now is stored. If we exit, enter again, and we need to prescribe the Amoxil 500, we simply come here, we select the specific prescription and click on Print. These are the dentist details, the patient's details, and the prescription. Now let's enter a letter. The letter can be anything from surgical instructions after tooth extraction or how to brush your teeth. Again, we click on New Text. We enter a description. Surgical instructions after tooth extraction, and we enter in here instructions, or if we want to, we can enter the same surgical instructions after tooth extraction. We can write our text in a word processor and simply copy it into the space. So immediately following surgery, bite firmly on the gauge pads covering each extraction. We can do a bit of formatting here so that it looks more readable. And once we're happy, we just say Save Text. Again, we can print it, and this is the way that it would look. If we need to change the date, we can do so, say 21st. But we always need to click on Save Text. So if we now print, the date is the 21st.